Today we're going to do an in-office whitening. Our patient is coming in. We have already taken some impressions so that they can do some take-home whitening at the end. They will do the take-home trays 10 days. Right now we're going to start with, we will put a retractor in. And this will go and pull the lips and the cheeks apart to keep any bleach from touching those areas. We will also place a gingival barrier. It's called a tissue dam, liquid dam, and this will go along the tissue, along the gum line, so that the bleach does not run from the tooth to the tissue. After we do that, we will place the desensitizer on. The desensitizer will be applied and then air dried, and then we will place the whitening solution on top and let that sit for about 15 minutes. We will do that 3 different series. After those 3 series are done, we will give our patients the take-home instructions that they will do for about 10 days that I mentioned at the beginning, and they will wear those trays for about an hour. If they do have some sensitivity, we will give them a tube of desensitizer that they will place in the trays. They will wear this also for about a half hour, and what that will do is it'll seal all those tubes in those teeth and make them less sensitive for them. We took off all the gingival barrier. We rinsed and gave him a good rinse of all the bleach that we had on there. We do have his beginning shade. He does have a little bit of bonding resin on tooth number 8. So there was his beginning shade, was an A3. And right now we have the patient's shade at a B1. So there you can see the before and afters of the whitening. Now the next thing we'd want to do on a situation like this is we will probably remove that resin that is on number 8, and we will place it with a shade that matches the other teeth, or we may even talk to the patient about doing something more permanent called a porcelain veneer. That would be the same color, would never whiten or darken, so we want to match the color, and we would place it on there, and it would be about a 10 to 15 year restoration.